Good afternoon, everybody. My name is Heidi Jones. I'm with the Washington State Healthcare Authority. I'm with the Contracts Work Group, and we're here to help facilitate a pre-application webinar for RFA 2021HCA12 for the Healthy Transitions Program. Within HCA, our Division of Behavioral Health and Recovery is running this RFA and the subsequent contracts. So we're just gonna take a minute or two here to just make sure everybody's technology works. So we'll, in probably about 5 minutes into the presentation, I'll hand it over to our DBHR person to begin talking about the program. So let's see. Okay, technology. Let's see. Well, first, before we go, can somebody put a message in the chat if you can hear me okay? Figuring you can, but just love to see that. Anyway, we will get started here. So technology. So while we're doing this presentation, it's always a good idea to close your other windows. If you're calling into the webinar with your phone, we have the number provided here at 415-930-5321, and then enter your audio PIN. There will be a point later where if we have time to answer questions in the chat box or unmute your microphone, then we'll need to have you enter that audio PIN so that we can hear you. And if you have trouble with the webinar, my email is here, but just with technology problems, it would be better if you could just put a message in the chat box. Let's see, just a second. Okay, perfect. Thank you, Sarah Ann. So we will keep on going, and this webinar is being recorded. We will have the transcript published in an amendment, and we will have the recording on YouTube, and that will be posted this coming Monday. Just like with the other questions and answers, we are posting questions and answers through the amendments on Mondays. And so we'll take all of the questions that we get here and the ones that we've gotten by email and put them all into that one thing. Let's see. I see a question. Questions pane. Hold on a second. Somebody asking a question here. Just a second. Oh, good. Thank you. You guys are great. You're pros at this. Thank you for the chats. Okay, webinar controls. I don't know if you have operated with GoToMeeting before, but here's just a few things. We have your attendees, so it should show your name and a little grab tab. This orange arrow should help put out. And then we have your hand. If you want to raise your hand, you can raise your hand or put your hand down. You can also, it works very well for you to enter questions in the chat box or the question box, and we'll be keeping an eye on that. We actually have 3 people who are watching this whole thing, and we're trying to feel like we're in an air traffic control tower trying to help this happen. And then your audio pane, if we are not able to hear you, you might want to double check to make sure that the setting is right, whether you're talking through your laptop or through the micro speakers. And then the question pane allows us to hear you. And then if your hand's down and you want to raise it up, it'll go the green arrow. And if your hand's up and you want to put it down, press the red arrow. And then more on the audio. The screenshot isn't showing the current code or pin, but it's just a screenshot to help you. So now we're about good. We're about 5 minutes into it. So hopefully we have everybody on now and everybody's getting set up. So again, this is Heidi Jones. I am the RFA coordinator and I work in the contracts division. And so I'm going to go over a little bit how we interact with this whole process before it gets all completed and DBHR takes over. So to start, I really want to sell WEBs to you. If you are not already signed up in the Washington Electronic Business Solution, I really strongly, more than strongly encourage you to do it. Is it's required. We are a state agency. All of Washington's state agencies are required to put their solicitations through this application, and so all of us have to do it. And so when we are going out to bid for something or procurement, we really want to find you. And Webs is where we try to find you. And if we can't find you in there, we can't notify you. And I can tell you, we've had a few emails come in already, and if folks who probably are not in Webs, they're saying, where can I get a copy of the RFA? And so we actually have it on our website. But there's about a 3-day delay. We post things. I could post something in Webs right now, but it would probably be 2 or 3 days before we get it on our website, just because our personnel and our capacity. I can tell you in our contracts unit, we have about 25 people, and we all keep an eye on this one email box. So we're all trying to do a lot of work for a lot of different things. And so having everything in Webs, one, it's required, but two, it helps us find you, and I'll get a little bit more into that. There's actually a manual for Webs, but you have to sign in to get it. So if you go to that link and you're expecting to see the RFA, I'm really sorry, because I get that. I get that when people just want to look at the paperwork and see if it's worth their trouble. I just want you to know it's just, we would just really have to. Hopefully, and I'm making myself clear on that. I can tell you that the Webs customer service is excellent. I call them all the time, and I write contracts for a living, and I call them and email them all the time. They're so helpful. And I even talked to somebody there yesterday, and I said, I'm really trying to sell this. I'm sending more people to you. And they said, please bring it. You know, we want to eliminate any barriers that are keeping people from doing business with the state. And two, we want to avoid any of the problems that people have in using the system. You know, for whatever improvements might be done, they can't be done if they don't know about it and they're not communicating with you. So I can just tell you, from my experience, has been really wonderful working with them. So one thing to know when you're going into Webs is there's this thing, it might be a new term for you. It's called a commodity code. And it's a federally issued uniform number. So in any state, you're going to have the same number for the type of business. So the example is 952-62 is an identifier that says, hey, I do mental health services that have to do with certain things. And that identifies what you do. Well, there's like 1,000 codes, but there might only be maybe 10 that really are relevant to your business. But what happens is you go into Webs and you say, I do this, and I do this, and I do this, and you check all these boxes. And then so you're identifying yourself in all the work that you do. And then someone like me, I go into Webs and I say, I'm looking for a vendor, and I enter all these commodity codes. And then Webs does the magic in connecting us so we can do work together. And so if you're set up in Webs, you are going to get every single alert for every single RFA, for every single state agency that goes out there. And so we will still publish our procurement opportunities on our website. If you just go to HCA website, and I think it's bids and contracts, and I didn't include it here just because it's a lot easier to find. But if you can get into Webs, you're going to be in the communication chain from here on out, and that's really what we want. It's not just what we want. It helps us because, again, we have to use it. And if you're getting information from any other portal, you're not getting complete information, and that can really be a barrier for people. So regardless of whether you're a nonprofit or profit or government, if you can get in Webs, that'd be great. So the last thing with Webs is that it's so important to use the business name the same way for everything. So if you submit an application and however it is, you have word for word, space and commas, everything exactly the same in WEBS. WEBS is kind of an older program, and we've had problems where we do keyword searches and we don't find people that are there. And so the other part of it is that if you're a DBA, if you're under a larger company and you have a DBA, whatever it is in WEBS, it needs to read exactly the same in the application, or we're not going to be able to find you. And so we want to find you. We want to match it. We don't want to go through this whole process and go, oh, you're not in WEBS, to have you say, yes, we are right here. So please, just consistent titling will just really help us find everybody. So one of the last things I want to cover, I know there's a lot of information on this slide, is just to explain to you what I do. I monitor this HCA procurements inbox. I'm one of about 25 people that looks in here. So it's so important, I'm going out of order here, but so important to have the RFA number or my name in the subject line, because there's so many people looking at it, and we're doing several RFAs at any given time and several procurements. So we just want to be able to zoom in on who needs to help you. And so when I'm watching for those emails and I'm watching for these applications, I'm looking to see if the RFA and is in the subject line of the email. We're asking for you to consolidate everything into one PDF. It takes me about an hour to read through an application if it's in one PDF, and it takes double the time if there's several attachments. And so it's just so you know that it streamlines everything. It allows us to do the real meat of the process is really looking at what you wrote, which is really the important part. And the faster we can do that, the better. And the best way to do that, everything in one PDF. The page limit is not exceeded. Try to, I think that in here it's 15 pages. And so trying to stay within that limit, and then making sure those documents are complete and in order. And depending on how many we get, depending on how many we're awarding, there could be an elimination process that is just based on that initial thing. And so my desire is to move everybody forward as possible. And so just wanted to underline that. So then it goes to the program. And so the behavioral health folks will evaluate and score the applications, and then I get it back and I finalize all the results and I notify everybody. And if for some reason you do not move forward, we offer a 30-minute debrief to go over your application and discuss it. So even in the sad situation where you're not the one chosen, we really want everybody to succeed. And so we are here to support you. We're here to share information with you and be as transparent as possible to help that happen. So in questions, just again, make sure it goes to this procurements inbox, has the RFA number, has my name, and then look on Mondays and WEBS for amendments. We will also publish the amendments on our webpage, but again, there's 2 or 3 delay to get there. And please don't send me individual emails. You can, logistically you can, but it's a more efficient process. If I were to be out of the office and it was just sent to me, I wouldn't, no one else would see it. And so we want, if I'm not here, we have a backup plan. So we want everybody to get the information they need. So that's all I have to say. And so I am going to hand this over to Martha Abbey, who is our program expert. And I will let her take over from here, and I will participate by advancing the slides. So Martha, you want to go ahead and get started?
Yeah. Hi, everyone. My name is Martha Abbey. I'd like to begin with a land acknowledgement. I am currently located in Seattle, the traditional territory of the coastal Salish people, specifically the Duwamish tribe. Just wanted to acknowledge the land and the role that the Indigenous people have played in both the United States and in Washington State in general. So keeping that in mind, just wanted to take some time to talk to you all about the Healthy Transitions Project here in the state of Washington, and the RFA and the potential for accepting applications to join our program. In today's webinar, we're going to be going through and talking about the purpose and background of the program, Healthy Transitions Program itself, required sections, and questions and answers. Heidi, do you think it might be possible for you to put yourself on mute?
Oh, yes.
Okay, great. Also, I'd also like to just introduce myself. I am a new employee for the Healthcare Authority. I started in February. I am pleased to be here. I have been a clinical social worker for like 20 years. And about half of that time I've been engaged in public policy or teaching or research. So I'm really excited about this program, and I'm excited to get to know all of you as time progresses. All right, next slide. So the purpose and background, continue. It's always a little tricky. Just to give you a little background, and you can see this in the RFA, which is one of the handouts, there are approximately 950,000 youth between the ages of 15 and 25 in Washington state alone. Transition age youth, or TAY, as they're referred to in both the RFA and in the federal project. We are looking at the age group of 16 to 25. They're at a higher risk of experiencing symptoms of mental illness, substance use, and then both earlier adolescents and older adults. And partly because of the transition age nature of their existences, TAY often face a significant instability in housing, education, employment, financial security, which obviously could be exacerbated by mental illness or symptoms of mental illness. Next slide. So back in 2018, the state of Washington was awarded a 5-year grant called the Healthy Transitions Project from SAMHSA, the Substance Abuse Mental Health Services Administration. We currently have 2 demonstration sites exploring the efficacy of peer support services, outreach engagement services, and a community health worker strategy. And those demonstration sites are located in Yakima and in the Vancouver area. So that's where our current demonstration sites are. I would also like to acknowledge that SAMHSA awarded the Lower Elwha and the Yakima Nations separately for their own healthy transition projects, which are also currently going in the state of Washington. So we'd like to add 2 more sites, and HCA obviously reserves the right to negotiate with the apparent successful applicant for project scope, including the number of individuals served and funding amounts, in order to get that sweet spot to make sure that we're testing a broad variety of different demonstration projects in order to meet our federal obligations. Next slide. So SAMHSA has its own project description, which is right there, that they would really like us to focus on 16 to 25-year-olds who have a serious emotional disturbance or a serious mental illness. Those words are federally defined. And it's expected that this program will improve emotional and behavioral health functioning and maximize their potential to have adult roles and responsibilities. So that's what SAMHSA has envisioned for this project. If we go to the next slide. When Washington answered the RFA to SAMHSA, we stated that we will serve youth in the 16 to 25 with SED, SMI, or co-occurring disorders, and that we have the following 6 goals. So the first goal is to increase the capacity to deliver age-specific integrated behavioral health treatment, community-based, recovery-oriented services. So by that, we're really thinking about how are we changing our system to focus on the specific developmental needs of someone in between that age range of 16 to 25. For a long period of time, we have siloed adult and children's mental health and behavioral health services which has often put a 13-year-old in the same program with an 18-year-old, or an 18-year-old in with a 50-year-old if they're in adult programming. And that doesn't always meet the developmental and social expectations of transition age youth. Goal 2 is to promote mental health awareness within the 16 to 25-year-old age range. Goal 3 is to provide peer navigation and other strategies to address serious mental illness, social emotional disturbance, and co-occurring. So we're really trying to explore what role peer services could have within the TAE population to increase both service access, to increase service efficacy, and so that was one of the key goals that we had in our project. Goal 4 is to implement evidence-based practices that are culturally and linguistically competent and also developmentally appropriate. Goal 5 is to engage youth and young adults in their treatment services and supports. So making sure that youth are a part of the table in determining their services and their needs rather than being told what to do. And then obviously 6 is to collaborate across state agencies, across provider networks, trying to shake things up to decrease silos. Not only decrease silos between the children's and the adults world, but also really looking at how can we better reorganize ourselves in a way that can meet the needs of the TAE population that has made it problematic for them to get their needs met. Next slide. This is a very helpful slide, and it's also in the RFA that talks about our timeline. The RFA was released on the 26th. Here we are in the pre-application webinar. We will receive questions by 5 p.m., I believe, on Thursdays, and then we'll post them on Mondays. We would like to receive applications by May 14th at 2 p.m. We will then take the time to evaluate them and then announce successful bidders and go through that normal process within HCA. Next slide. So obviously an important factor is who is an eligible entity. Because of the fact that our SAMHSA grant began in 2018 and it's a 5-year grant, we are looking at that this project would be available through this federal fiscal year, which ends September 30th, 2021, and then it would go through the next 2 federal fiscal years, with ending September 2023. All these different fiscal years and the different timeframes sometimes gets a little confusing. So it's always important to keep that in mind. Because we have such a shorter time frame in order to spend these dollars and to create the startup programming for the new innovations that we're hoping to see, we wanted to make sure that the partners in these arrangements also have the ability by at least the next federal fiscal year to start billing third parties or Medicaid in order to help support these services in the community or in the program. So we'd like to, we put the eligible entities in the sense of 1, nonprofit or small businesses that provide a commitment to becoming a behavioral health agency licensed in the state of Washington with and certified to provide individual treatment services and peer support services, or a local government or nonprofit small business that have a documented memorandum of understanding with a BHA that is certified in individual treatment services or peer support services. And 3, a nonprofit or small business clinic licensed as a behavioral health agency, including tribal BHAs in the state of Washington that are certified to provide individual treatment services and peer support services. So these are the eligible entities as we have defined them. So next slide, please. We are separating out our applicants into type A and type B. So type A are applicants who have a current or existing or previous contract with HCA or the Division of Behavioral Health and Recovery. Type B are folks that have no existing contract or subcontract, and they are a completely new applicant into the HCA DBHR world. So in the application process, you will need to assert whether or not you are type A or type B. And we have determined in an attempt to engage with new partners that at least one of the successful respondents will be from type B. Next slide, please. We also are taking very seriously the state's initiative to build business diversity. And so these links that are embedded within the PowerPoint structure, which is also one of the handouts, that we are interested in working with small businesses and businesses owned by minorities, women, or veterans. And that is also something that we are going to ask you to self-identify. Next question, please. Or next slide. So, overview of all the projects. With every single successful applicant or someone who we engage in contract negotiations, we are interested in a mixture of services to be provided with transition age youth. Services may be clinical or non-clinical, and SAMHSA and DBHR have data collection requirements, and each site must select and implement an evidence-based practice. These are required, the evidence-based practice is a requirement from SAMHSA. Next slide. So some of the allowable non-clinical activities are things like youth advocacy and empowerment, doing provider training to enhance the skills of the community in regards to developmentally appropriate services or program characteristics, clinical supervision costs, program and partnership development, evidence-based practice training and implementation requirements, and outreach and engagement with community stakeholders, public awareness messaging, things like that. Next slide. Allowable clinical activities that look more at community education, education and outreach, individual treatment services, family education, intake and evaluation, psychoeducation, peer support services, supported employment and education, interpreter services, medication management, and medication monitoring. Next slide, please. We are committed to integrated care, and looking at ending health disparities and engaging in anti-poverty efforts. So priority will be given to applicants that focus on integrated programs that involve youth from BIPOC and LGBTQ communities, and programs that target populations that are at risk or currently homeless, in the need of employment support, involved with the justice system, and benefiting from education support, and formally involved in the foster care system. We also are looking for respondents that are, the services are culturally and developmentally appropriate for transition age youth. Next slide, please. So possible scopes of work. The next 3 slides talk more about what are some of the items. This is a little bit redundant with the allowable activities, but looking at developing partnerships and outreach and engagement, startup needs for creating new partnerships, looking at like electronic health records, telehealth system development, management information systems, and office equipment needs, evidence-based practices or training or implementation costs, like what you might need in order to maintain fidelity standards and those different types of things, program and agency policy procedures development for service enhancement, and what kind of training is needed for cross-system providers. Next slide. So we're also looking at what kind of mental health services you could provide, and what services, like how these funds could be used for uninsured or underinsured individuals, and what kind of costs are associated with developing youth advisory boards or other programming to promote and sustain youth and family participation. And then also costs for data collection and reporting as required by both the evidence-based practice, HCA, and SAMHSA. Next. So additionally, once someone becomes a grantee, there's an expectation that they would meet with monthly group meetings with all of the grantees and quarterly site meetings to discuss program focuses. And then we will provide training and technical assistance to increase the contractor's capacity in reporting, billing, and implementing systems. And that HCA understands that people who are new to the HCA system requires additional support for invoices, tracking, and all those other different types of things. And that folks will be working with the HCA program manager to demonstrate compliance for reporting, billing. Next slide. All right, so now the fun part, required section. So we'd like to hold the phone. Before you begin, we want to just kind of look and find, we want you to think about whether or not you're an applicant A or an applicant type B. And so we're going to launch a poll here just to see if we can get an idea of how many of each type are listening right now. So remember, type A, current or prior contract with HCA, type B, new to doing business with HCA. Okay. Well, we've got 88% of the folks have voted. So I think we can go back probably to the screen. Thanks. So yeah, it's going to be helpful for us if you identify that. That'll really help in the reviewing process, especially for Heidi and Sarah Ann's Fortune. So next slide, please. So application contents, these are obviously in the RFA. We have an attachment that is the application face page, the minimum qualifications where you identify which one of the eligible applicants you are, a budget, the budget narrative, both there's a spreadsheet and then a narrative that goes along with the budget, a program narrative, a project description that includes an implementation overview, health disparities and special populations, youth engagement involvement, implementation schedule and work plan, and then outcome measures and performance measurement proposal, and then up to 4 letters of support. Next slide. I wanted to take a little brief moment to talk about the program goals and outcomes. We'd like to, these are potential areas that you might focus on in your RFA, looking at either client services, staff training, provider partnerships, evidence-based or evidence-supported practices, and then funding stability. We'd like to look at the goals for your program, interventions, and then different types of measures. And if we can go to the next slide, I've got a sample. So if this is a program that is looking to assist transition age youth from leaving from involuntary systems to voluntary systems in the juvenile rehabilitation world. We have the area of client services. The goal is to transition folks from one system to another. These are the different types of interventions that someone might do. And then these are the measures that we might have within the first, this first grant period from July 1 to the end of September. So obviously, if you're looking at years 2 and 3 of the projections, those numbers would be higher. So, and we can go back and talk about this later if there are further questions. Within the budget, we have both a template and we expect a narrative. When preparing your budget, make sure that each cell has a total or subtotal, and that it's added as attachment B in your packet, and that it's crucial that funds are not being used to supplant current or existing programs. Scores will be based on how well you complete and the clear answers for each question, and you are not required to request the maximum amount. Rather, please provide your best estimate for the costs that you have for implementing your project plan or portions of your plan. So, yeah. Next slide. It's important to organize your budget based on the contract year. And again, these contract years are based on the federal fiscal year. So July 1 to September 30th of 2021, October 1, 2021 to September 30th, 2022, October 1, 2022 to September 30th, 2023. And you can see the allowable amounts on the slide. This is how we plan on, this is how the points are delegated for each section. The budget and budget narrative is 20 points. The project narrative with overview of your agency is 5 points. The community need is 5 points. And then the project description, which is the bulk of the points, we would like to hear more about the project overview, health disparities in special populations, like how your plan in particular attempts at decreasing health disparities within and what type of special population you are reaching out to within your proposal. Youth engagement strategies is 10 points. Your implementation schedule and work plan is again worth 10 points. And lastly, your outcome measures, your performance measurement, and how you plan on collecting data is 10 points. We have put aside 20 points for letters of support. Each letter, up to 4, is worth 5 points. So as you can tell, it's we would like these proposals to be really community-based and connected with other programs. Because again, we're looking at reorganizing the traditional silos within our behavioral health system and that have made things more complicated for our youth. Lastly, if you are in one of your eligible applicant types that requires you to have an MOU or a letter of understanding between your agency and a behavioral health agency for that partnership, we require that there be an MOU within the application, and that is pass or no pass based on whether you have it or you don't. Right, and then we'd also like you to state whether or not you are registered with the Office of Minority and Women's Business and Enterprises. So we will be using these points in order to evaluate and score each application. Next, please. Questions and answers. Very exciting. So as we stated before, all questions after this webinar need to be submitted to HCA procurements. And in the title, please put 2021 HCA12 in the title of the email and Heidi Jones's name. That would be very helpful as we're trying to sort through them. Every Thursday by 4 p.m. during the RFA period, we will collect all of the questions, and then answers will be provided by 5 p.m. in WEBs on Monday. All right, so I think that gets us to questions that people have here. I can't see any questions in the question system.
Martha, this is Heidi. I wanted to ask if we could make a clarification here on the slide on page 37 on the number 5, I think this would include the veteran status as well. Would that be correct?
Yes.
Okay, great.
And
All
it
right.
also includes whether or not your partner organization is
Right.
registered.
And that's where it connects like with the MOU thing.
Mm-hmm.
Okay, thank you.
So do folks have questions? You can either type them into the chat or the question box or raise your hand to speak. Have I done such a great job of explaining that there are no questions? That seems. All right. Well, we'll just be here for a little bit longer just to see if questions pop up. We really appreciate people coming today and learning more about this RFA opportunity. It's been really great to share this with all of you.
Oh, and just a reminder, this is recorded, so we will be posting this on YouTube. Again, think of like the 3-day delay or something. So hopefully by Monday, we'll have the YouTube link to publish that if you wanted to go over any of the other information.
All right. Well, barring any raised hands or questions, I think should we end the session?
Yeah, we can wrap it up. And but thank you for participating. And if you have any other questions, feel free to email them along. But also, if you've never participated in a webinar before, it's totally okay to raise your hand and do the chat. We just never know. Sometimes we have a lot, and sometimes we just have a few. So that's great. Well, thank you. I will stop recording, and we will sign off. Thank you.